Okay, so today we will talk about androgenic alopecia. It is also called male pattern baldness. So it's the most common type of baldness that is seen commonly in men. And so first, let's talk about what it is, and what is the cause, the main cause, the root cause of this androgenic alopecia or male pattern baldness or simple male baldness. So the reason that it affects males most commonly is because of the male hormones. Male have a hormone called testosterone. Okay, everyone probably is already aware of it. So then the testosterone is converted by an enzyme into something called the dihydrotestosterone. It's DHT. It is called dihydrotestosterone by an enzyme called the 5-alpha reductase. 5-alpha reductase. Okay, so this enzyme will convert testosterone into dihydrotestosterone, and this dihydrotestosterone will then act on the hair follicles here, and it will cause thinning of hair, and then that thin hair will then eventually be lost. So the dihydrotestosterone will cause thinning of hair, and then over several years this will result in hair loss. So this process of thinning hair and then hair loss, this thinning of hairing is also called miniaturization. So this thinning of hair and then hearing loss, the progression of this, the timeline of this, like how many years it will take for the hair to be completely lost, it varies from person to person. So some people will just rapidly lose their hair, while some people will lose their hair over many years, like slowly and gradually. So the timeline and the duration, and the progression, the rapidity of that progression, it varies from person to person. So that was basically the idea of how the hair loss occur in men. And so it is a polygenic inheritance. So it's actually inherited, and it's polygenic, which means many genes are involved in its inheritance. Okay, so then there are different patterns of, like, where the hair is lost at first, and then where it is lost later on, as the baldness progresses. So in the most commonly, you will see that on the side or the temples, the hair on the sides or the temples will be lost first. This is called temporal baldness. Temporal baldness, and after that, you will see the crown here or the vertex. It will kind of start to lose hair, and so it depends on the person then, also. But the most common the most common locations are the temporal, or the side of the hair, and also the vertex. So these are the most common areas where the hair will be lost. So then, now we know the cause, but now let's come down to the treatment. So how do you treat this condition? So there are two FDA approved drugs that we can use for this. So the first is is finasteride. So what is finasteride? So it is a 1-a-day pill. It's usually 1 milligram per day. So it is taken like once a day, and it's a pill that inhibits this enzyme. So guess what will happen when finasteride inhibits the DHT? The DHT cannot work here. Okay, so the finasteride is kind of blocking its effect on the hair, and hence the hair will not fall. And so this is the reason. But the thing about finasteride is that you have to take them forever in order to keep the hair on your head. Okay, so you have to keep it forever, so to prevent the DHT from acting on your hair. Okay, so then so most of the people are actually concerned about the side effects of finasteride. So the most commonly reported the side effect is sexual side effect, like decreased libido, which means decreased desire to have sex, to have intercourse. So this is the decreased desire. And one thing that people should know is that this side effect is seen only in 2% of the people taking finasteride, which means out of 100 taking finasteride, out of 100 taking finasteride, only 2 will 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 have these side effects. Will feel this side effect, while 98 will have no side effect whatsoever. Then also in a study in the study on the finasteride that was done, it also showed that this 2% was actually a placebo effect. Placebo effect is when an effect is not there, but because it is just a mentally created thing where the patient just feel like they're feeling the side effect, but there is actually in reality there is actually no effect. It's just all in their head basically. So the second drug that is used is minoxidil. 5% minoxidil. It's a spray. It can be in spray form. It's also in the topical liquid form. So it's basically topical, which means you directly apply it to the hair. You don't actually it's not in a pill form. This one is a pill. So minoxidil you just apply to the bald spots, and then it's just kind of like what it does is that. So what does minoxidil do? So minoxidil is actually a potassium channel inhibitor. So it's a channel inhibitor. So we have a vessel here. So it acts on the vessel, and then it dilates that vessel. So it's actually dilating the vessels. So when it dilates the vessel here in the hair, it will increase the blood flow to the hair, and that would actually increase the growth of the hair, and it will decrease its tendency to fall. So that's basically how minoxidil works. And just remember that these two, when these two are combined together, they give better result than when they are given alone. And also, they take like many months in order to show effect, like 6 months or even a year in some people. So in order to show effect, so when you use these, your hair will just kind of be the same. And some people, like most people, actually even see more hair growth, like increased hair growth. Okay, so then if these two don't work, then the last result is always a hair transplant. Okay, and if it's successful, then your hair will never fall if it's successful. Okay, so this was just a short topic on male pattern baldness, and hope it was helpful.